This is chapter 35, the endocrine system. So these are the major glands in the endocrine system: the pituitary gland, the thyroid gland, the parathyroid glands, adrenal glands, and pancreas are the major glands in the endocrine system. And so we'll talk about disorders of these areas as we go through the endocrine system. Okay, so I'm not going to go through each of these glands, but I did post a video to Blackboard that goes in great detail about each gland and which hormones they produce. And so you need to understand which hormones each of the glands produce, because then it kind of helps you understand some of the things that happen and some of the disorders that go along with with each endocrine disorder. It'll help you to understand if you know which gland produces which what hormones. Okay, I'll just briefly go through these glands, but I did post a video to Blackboard that goes into great detail to further help you explain each of these glands and what they produce. So we'll start here with the pituitary gland. So this is located in the inferior aspect of the brain, and it's called the master gland because it regulates a lot of key processes. It has two lobes: the posterior lobe, which stores and releases oxytocin and the antidiuretic hormone, which is produced by the hypothalamus, and then the anterior lobe. The anterior lobe produces at least 6 hormones: the growth hormone, the thyroid stimulating hormone, corticotropin, the follicle stimulating hormone, the luteinizing hormone, and then the prolactin hormone as well. So as I stated, this pituitary gland produces or that has the posterior lobe as well. In the posterior lobe, it stores and releases this oxytocin and antidiuretic hormone. And like I said, if you go to the video on Blackboard, it goes into quite a bit of detail for you as to what each of these glands produce and the hormones. This thyroid gland, it's directly below the larynx and partially in front of the trachea. So it's 2 lateral lobes, one on both sides, either side of the trachea, with a narrow tissue bridge, and that is called the isthmus. ISTHMUS. So that's what sometimes you might hear that this gland has like a butterfly shape. That's what gives it the butterfly shape. The 2 lobes of the thyroid function as one to produce 2 hormones, and that's T3 and T4. And so they're collectively referred to as the thyroid hormone, and they're the body's major metabolic hormones. Also produces calcitonin, and so calcitonin maintains the blood calcium level. So 4 parathyroid glands lie embedded on the posterior surface of the thyroid, one in each corner. Like the thyroid lobes, the parathyroid glands work together as a single gland, producing the parathyroid hormone, which helps regulate the blood's calcium balance. The 2 adrenal glands sit on top of the 2 kidneys. Each gland contains 2 distinct structures, the adrenal cortex and the adrenal medulla, and they function as separate endocrine glands. The adrenal medulla is the inner portion. It produces catecholamines because catecholamines play an important role in the autoimmune nervous system. The adrenal medulla is considered a neuroendocrine structure. And the adrenal cortex produces aldosterone, cortisol, and then the androgens and estrogens. So again, like I said, I didn't really go into a lot of detail in the glands because I did post a video that really, discusses this and outlines the glands. And, you really need to understand which gland produces which hormones, because it will help you to understand why certain things happen with certain diseases. So the pancreas, it's in the curve of the duodenum, and it stretches horizontally beyond or behind the stomach and extends to the spleen. The islets of Langerhans perform the endocrine function of this gland, and it contains the alpha, the beta, and the delta cells. The alpha cells produce glucagon, the beta cells produce insulin, and the delta cells produce somatostatin. Okay, so when we're talking about effects of aging on the endocrine system, the pituitary gland actually becomes smaller. So when we talk about that, the thyroid gland gets lumpy, and metabolism gradually declines. So when our metabolism declines, everything starts to get slower, and so as a result, we're feeling tired a lot. We might be gaining weight. Our hair starts thinning. Irregular menstrual cycles. Feeling cold. If you notice, elderly patients all the time, they want their heat up on 80 and have 10 blankets on or something. I'm probably exaggerating, but they really like to have the heat blasting because they feel cold because their metabolism is declining. They have dry skin, so that's a result of the those are results of the metabolism being decreased. The norepinephrine increases, and so that is something that helps you cope with stress. So maybe you're having difficulty coping with stress as well. Estrogen, we talk about estrogen decreasing. That's going to be an effect of the, maybe irregular cycles. Luteinizing hormone increases. That's, something that helps with ovulation. So they'll have, symptoms with that. Their blood glucose levels begin to rise as well. Okay, so when we talk about effects of aging on the endocrine system, our pituitary gland becomes smaller, making a lot of different, causing a lot of different issues. So our metabolism starts to decline. So as we'll talk about in the next chapter, when the metabolism starts to decline, things start to slow up in the body. So you start to feel tired a lot. You might have weight gain. Your hair starts to thin. Irregular cycles. You might feel cold. If you notice, a lot of times your elderly patients, they like to have the heat up on 80 and then still have 5-6 blankets or so on, because they're cold all the time. Their skin may be dry a lot, so you got to keep their skin moisturized. They might be more stressed, not able to handle stress as well. So they have a lot of different issues. Their ADH, which helps increase water reabsorption, starts to increase. And so we'll talk about a couple of diseases specific to the antidiuretic hormone in the next chapter as well. Also, their blood glucose levels begin to rise. So they have a lot of things that that's going on with their endocrine system that could be causing a lot of different issues for them. So a lot of times thyroid disorders are pretty common among our elderly patients. But as we stated on the previous page, they have a decreased glucose tolerance. So this causes them to have increased blood glucose, so hyperglycemia, and puts them, more at risk for type 2 diabetes as well, diabetes mellitus specifically. At the same time, they can get hypoglycemic quicker than younger adults, and a decrease in hormones that make it difficult for them to adapt to stress as well. The main function of the endocrine system is to create and release hormones directly into the bloodstream and the body fluids. When the hormone is released, it has a target site that it's trying to get to. So when it reaches its target site, it binds to a specific receptor on the cell membrane or within the cell itself. After it binds to the cell membrane or the cell, each hormone produces unique physiologic changes depending on its site, on its target site, and the specific action at that site. One hormone can actually have different effects at different target sites. So you have several hormones that are being released by the various glands, and so they have specific actions within the body that they must complete. So when we're talking about feedback refers to information sent to the endocrine glands that signals the need for changes in the hormone levels, either increasing or decreasing the hormone production. And so if the target cell is receiving enough hormones, then no additional hormones need to be, will be produced or secreted at that time. Endocrine dysfunction takes one of two forms: hyperfunction, which results in excessive hormone production or response, or hypofunction, which results from a relative or absolute hormone deficiency, Hormonal imbalance can also be classified according to the disease. Disease within an endocrine gland causes a primary dysfunction, whereas diseases caused by a dysfunction outside of a particular endocrine gland but affecting that gland or its hormone, the hormones that it might produce, that's called secondary dysfunction. So as the nurse, we're going to be conducting an assessment on our patient to check their endocrine status. We're going to do a health history and a physical examination. But we want to, depending on what's going on with our patient, we want to, of course, prevent any injuries from occurring with our patient. Keep their stress level down, make sure their fluid and electrolyte balances are intact. Hormone balances, of course, that's what we're talking about with the endocrine system, making sure their hormone balances are intact as well. Okay, so you're going to ask your patient about previous medical history. You want to, so all medical history, any ask if they had any skull fracture surgeries, complication with surgeries, brain infections like meningitis or encephalitis or anything like that. You want to ask the patient about, of course, what their main concerns are. Are they having any fatigue or weakness or weight changes, any changes in their mental status, their hair, their nails, bowel changes, urine, are they having excessive urination, excessive thirst, excessive hunger, any abnormalities in their sexual functioning. You also want to find out about their family history. Do they have a family history of any endocrine disorders, any lifestyle patterns? Ask them about temperature intolerance. Do they have any intolerance to temperatures? Because these could indicate, of course, thyroid problems. You want to do a physical examination. It should include a total body evaluation, a complete neurologic assessment, because the hypothalamus plays an important role in regulating endocrine function. You want to measure their vital signs, their height, their weight, compare findings with the normal expected values of these things, and also you want to take into consideration the patient's baseline measurements for these things as well. And then you want to go through your whole process, inspect, palpate, auscultate the patient to get your objective findings as well. And when you inspect, of course, you want to inspect systematically the overall appearance and examine all areas. So making sure, and then their body image, because with some of these endocrine disorders, as we'll see, their body image could be distorted. So assess that as well, because they could have some emotional challenges with that as well.